Each year, millions of Americans take prescription medications. When taken properly, prescription drugs can help people achieve a higher quality of life than otherwise possible. However, when prescriptions are taken without proper care and understanding, the results can be costly. For example, professionals estimate that 1 in 4 hospital admissions of seniors result from medication problems, including prescription drug interactions. The goal of this video is to increase your awareness of some of the issues involved in taking prescription and non-prescription drugs, so that you can obtain their maximum benefit. If you take several different medicines, see more than one doctor, or have certain health conditions, you and your doctors need to be aware of all the medicines you take. Doing so will help you avoid potential problems such as drug interactions. Drug interactions may make your drug less effective, cause unexpected side effects, or increase the action of a particular drug. Some drug interactions can even be harmful to you. Reading the label every time you use a non-prescription or prescription drug and taking the time to learn about drug interactions may be critical to your health. If you have any questions about why a medication is being prescribed for you or what its side effects may be, ask your physician. Drug interactions fall into 3 broad categories. Drug-to-drug interactions occur when 2 or more drugs react with each other, sometimes causing unexpected side effects. For example, mixing sedatives, like sleeping pills, with an antihistamine, such as allergy medication, can slow your reactions and impair your ability to drive a car or operate machinery. Drugs may also interact with foods or beverages. For example, mixing alcohol with some drugs may cause you to feel tired or slow your reactions. Drug and condition interactions may occur when an existing medical condition makes certain drugs potentially harmful. For example, if you have high blood pressure, taking a nasal decongestant may cause an unwanted reaction. Over-the-counter drug labels contain information about ingredients, uses, warnings, and directions. It is important to read and understand this information. The label also lists possible drug interactions. Because drug labels may change as new information becomes known, it's especially important to read the label every time you use a drug. Look for the following sections on a label: active ingredients and purpose, uses, warnings, directions, other information, inactive ingredients, and questions or comments. Remember that different over-the-counter and prescription drugs may contain the same active ingredient. If you are taking more than one, pay attention to their active ingredients to avoid taking too much of a specific ingredient. Under certain circumstances, such as a pregnancy or during breastfeeding, you should talk to your doctor before you take any medicine. Also note the inactive ingredients on the label and avoid those you are allergic to. To learn more about drug interactions, talk to your doctor or pharmacist about the drugs you take. When your doctor prescribes a new drug, discuss all over-the-counter and prescription drugs you take, as well as dietary supplements, vitamins, botanicals, minerals and herbals, and the foods you eat. When you talk to your pharmacist, ask him or her for the package insert for each prescription drug you take. The package insert provides more information about potential drug interactions. Before taking a drug, ask your doctor or pharmacist the following questions. Can I take it with other drugs? Should I avoid certain foods, beverages, or other products? What are possible drug interaction signs I should know about? How will the drug work in my body? Is there more information available about the drug or my condition on the internet or in health and medical literature? Another risk sometimes associated with taking prescription drugs is the possibility of addiction. The 2003 National Survey on Drug Use and Health estimates that 6.3 million Americans aged 12 and older had taken medications not prescribed for them or took medications solely for pleasure or entertainment in the month preceding the survey. If you have any concerns about addiction to prescription drugs, you should discuss them with your doctor. Your doctor needs this information to choose the medication that will work best for you. If you feel that your prescription is inappropriate in terms of drug type, dosage, or duration, express your concern immediately. Frequent assessment and follow-up with your doctor will ensure that you're taking the safest and most effective amount of medication. One last potential drawback of taking prescription medications is cost. However, many people may be able to reduce the cost of their medications by taking generics. Consider the following. Generic medications may have a different appearance than their brand name equivalent. That's because they often contain different inactive ingredients, such as fillers and dyes. A small number of people might react to these inactive ingredients, so be sure to check with your doctor or pharmacist about any possible side effects that you may experience. That said, the FDA requires that generics contain the same active ingredients as the original brand name drug. They must also be equivalent in strength and dosage and be expected to produce the same effect in the body. If you feel that generics may provide a money-saving alternative, discuss using them with your doctor. Be sure to stay on top of all the prescription and over-the-counter medications you are taking. When taken with understanding, as directed by your physician and your pharmacist, these medications can greatly impact your health for the better.